Let's turn though to the story that's been breaking at the top, the latest twist in the Sushant Singh Rajput death case, where actor Rhea Chakraborty, who was Sushant's girlfriend, her brother Showik, has been arrested by the Narcotics Bureau. Rhea's brother was grilled for his alleged drug links. Samuel Miranda, the manager of Sushant Singh Rajput, has also been arrested. 3 drug dealers claim that Showik took drugs from them. WhatsApp chats between Rhea and Showik had showed that the two were talking about bud and doobies. The drugs were allegedly meant for Sushant Singh Rajput. That's what Showik has claimed, that Sushant Singh Rajput used to take drugs on a daily basis. This is what is being claimed by the investigation and the confessions that have been made, that they were taking drugs for. Okay, joining us now are Sahil Joshi is joining us and Devesh Singh. Both of them are 2 reporters are joining us from the spot. Devesh Singh, you tell us what exactly is the charge under which Showik has been arrested.
Rajdeep sir, I would like to tell this that the zonal director has just confirmed in India Today that Showik is yet to be arrested. He has not been arrested formally yet. Within an hour and a half, they'll take a call whether he has to be arrested, and an arrest memo could be served. Though sources are telling us that arrest seems very likely, but the formal arrest hasn't been shown yet by the Narcotics Control Bureau, and the arrest memo hasn't been served to Showik and Samuel Miranda yet. But the rigorous hours of questioning did happen, in which sources tell us that Samuel revealed that it was through Showik that he was in touch with drug peddlers, and drug peddlers who've been already arrested by Narcotics Control Bureau. They've revealed that they were in touch with Showik, and Showik did procure drugs through Samuel Miranda from these drug peddlers, which were banned narcotic substances. And also Showik has told NCB officials that the drugs that he had procured, or he had helped procure, were for Sushant Singh Rajput, because Sushant was consuming drugs on a regular basis.
No, that's important. You are saying that Showik has said he was procuring drugs for Sushant and for Rhea, or was it just for Sushant? Because where does Rhea Chakraborty, is she likely to be arrested next?
The further course of action will be decided once the Narcotics Control Bureau produces Showik Chakraborty and Samuel Miranda and seeks their custody. But it is highly likely that Rhea Chakraborty is the next to be summoned in this case, because she's been named as an accused. In fact, she's the prime accused. To her, it was her WhatsApp chats that brought to light communication regarding banned narcotic substances, after which a disclosure report was sent by the Enforcement Directorate to Narcotics Control Bureau, and Narcotics Control Bureau registered a case to investigate it further. A special team was created in Delhi, which has been sent to Mumbai. A senior IRS officer who was with DRI has been loaned to Narcotics Control Bureau for 6 months, especially to supervise investigations in this case. So Rhea Chakraborty is the next person who could be summoned, and only when she is interrogated, when she is questioned, as per her statements, if the Narcotics Control Bureau feels that she is not cooperating with the probe, her custody could be sought.
Sahil Joshi, in a way this case started with nepotism, and it is now turning out to be narcotics. Until now it was nepotism, money laundering, abetment to suicide, cheating. All those charges now seem to have gone to the background. The CBI investigation seems to be pushed to the background. The focus suddenly is on narcotics and allegedly procuring drugs for Sushant. That both Showik and Rhea were procuring drugs for Sushant. These were questions we had asked her, and that time Rhea had denied procuring drugs for Sushant. So clearly Rhea Chakraborty will have much to answer.
Absolutely. In fact, we would like to also clarify that the Sushant Singh Rajput's death case has been investigated not by Narcotics Control Bureau, but it's been investigated by the Central Bureau of Investigation, that is CBI. Now the chats which has come forward because through the investigation what happened in Enforcement Directorate. Now, there is a different link altogether. During the interrogation of Enforcement Directorate, the Enforcement Directorate, took the data of the mobile phone of Showik Chakraborty as well as Rhea Chakraborty. While searching the data, they used certain keywords were inserted to understand what was the discussion in the WhatsApp chats or any other SMSs or any other chat applications possible in the mobile phones. During that time, the Enforcement Directorate chanced upon these particular chats in which there was a discussion about the drugs. Someone wants drugs. The name was not specified about the chats which were leaked to the media. Then these particular chats were given to the Narcotics Control Bureau, and on the basis of that, Narcotics Control Bureau registered a separate case of the drug trafficking, consumption of the drugs, etc., under NDPS Act. And after that, the NCB started investigation in this particular case, in which they have already arrested 5 people, out of which 2 people are already on the bail. 3 people are now in the custody of Narcotics Control Bureau. And as Divesh was mentioning, it looks like that Showik's arrest is now evident. It's going to happen in some time. Samuel Miranda, who is a house manager of Sushant Singh Rajput, will also be arrested, is also likely to be arrested. Now, the remand copy of the people who were arrested yesterday were taken to the court today. And in that remand copy, the NCB has claimed that they were procuring drugs on the instructions of Showik Chakraborty and were giving it to Samuel Miranda to give it to Sushant Singh Rajput. So that angle is completely different altogether. Now, whether Sushant Singh Rajput's death is anyway linked to this consumption of drug, it's something now the CBI will investigate. But as far as this case is concerned, it is about the procurement of the drugs. And of course,
let me take what you're saying.
Consumption is yet to be.
Let me take what you're saying to Yashovardhan Azad, senior police officer, someone who has served in very high capacities in the government, including the IB. Yashovardhan Azad explained this to us. A case which was started by the CBI in terms of abetment to suicide, money laundering is what the Bihar police claim, now is moving in the direction of drug consumption and in this case drug procurement. Under the NDPS Act, apparently this is a bailable offence unless you are able to prove that the person was actually at that moment you catch him in consumption, in possession or consumption of a large amount of drugs. How do you see the trajectory of this case from abetment to suicide to now narcotics?
You're right, Rajdeep. It's a very interesting turn in the investigation. And in fact, if the attempt by the NCB or the government is to clean up Bollywood of drugs, it's an excellent move. But the only problem is that if you are relying on the testimony of the drug peddlers and the electronic evidence based on WhatsApp chats, I'm sure there'll be quite a few people who'll come under the net. Unless Miranda and both Showik have confessed, saying that we used to take drugs for the sake of Sushant. That's number one. But number two, my point is, and going back to what you were talking about, the investigation has started completely on a different note. And therefore, the CBI is still looking at 2 angles. First is whether the death is by suicide or it was a murder. And second, whether it is abetment to suicide. Now, abetment of suicide, all those things which we're talking about, the involvement of the ED, the property, etc., and the money withdrawn and the cheating, that so far nothing has come up on that count. Now, the drug in this investigation, it's most important to prove that he was drugged so much that he was moved towards abetment of suicide. Now, that is still in balance because it's the CBI which is investigating, and the NCB's arrest of Showik, I don't know how much of impact will actually have on the investigation. One thing, last point I must say, that CBI is obviously digging very, very deep, because even after 30 hours of investigation, nothing really has come out. But of course, CBI is a very professional organization. It just not let out the details of its investigation. So I'm sure they'll be looking into this aspect very, very closely, whether this drug connection really connected with the abetment. Because one of the allegations by the family was that he was being over-drugged. But 2 points I just want to say, and that is, first is that on the 8th, Rhea had left. Rhea had complained to the doctor saying that he has stopped his medicine, and the sister had taken over. And the sister also left on 12th, presuming that he was all right. So these are very, very important points.
But what what you're saying, Mr. Azad, is that there are two very different investigations now taking place. There is one investigation which is attempt to suicide, there, as some are suggesting murder, the possibility which so far is not proven. They are claiming money laundering, cheating. That is being investigated by the CBI. The money laundering by the ED. In fact, 3 investigations. ED and CBI don't seem to have built a case as yet. Now comes the NCB and says, look, we're going to catch you on for procuring drugs for Sushant and Rhea. So it seems almost as if 3 very different investigations are taking place.
Absolutely. There are 3 different streams. And whether, Showik was involved in drug peddling or not, or even Rhea was taking it casually or not, the main issue which is crying for closure is the investigation into Sushant's death. And what is looking for is a dignified closure to his case. First, whether it was a suicide or a murder. And second, whether it was abetment to suicide created by a conspiracy amongst Rhea and her relatives.
Right. Very interesting. What happens now, Devesh? You are on the ground. They've been, you're saying that in the next couple of hours, possibly the formal charges will be served on Showik and Samuel Miranda. Is there a plan from your sources, Devesh, that others will also be questioned now? Is there a plan to get Rhea to be questioned tomorrow? Okay, we're getting Majid Memon on phone, senior lawyer. Majid Memon, how do you interpret this case? Is this a bailable offense, procurement of drugs?
Well, you see, the drug angle may probably or may not have any connection with the widely spoken about incident of 14th of June when Sushant hanged himself. Well, whether this habit of doing drugs or dealing in drugs in some way with some agents or some suppliers is a matter which could independently be examined by the Narcotics Bureau, independent of the incident of 14th of June. Because you see, in fact, in Bollywood, I don't think this is coming as a surprise that many of the artists, who work physically very hard, do drugs, and to what extent they commit breach of the statutory provisions, or whether they are, if they are consuming it, it would be a lighter offense. If they are dealing in it, it would be a graver offense. And then there are several other provisions under the NDPS Act. But as I would say that the anxiety of the whole country is to connect with this discovery of some drug dealing within city of Mumbai or within Bollywood would have something to do with Sushant's ending his life. But I have my own doubts whether the two can be connected.
So these are 2 different cases at the moment. Whether those connections can be built now between drug procurement and Sushant's death remains to be seen. As of now, the NCB is the one which has been proactive in terms of actually executing arrests for procurement of drugs for Sushant Singh Rajput. Questions therefore to be raised in the context of that at the moment. Thank you all very much for joining me on that story. We need to move on to the other big story that we are tracking today. That's right. Let's turn to our other big focus this evening, and it is on what should become the major issue again, the COVID curve that simply is not flattening, but it's showing signs of rising at the moment. And who better than to take us through our COVID question than someone who's been with us right through this entire 5 months. Every month he joins us, Dr. Rajdeep Guleria, the All India Institute of Medical Sciences Director. Appreciate your joining us. We're back, sir, with our 20 questions for you, which have been so popular. Let me turn to all our viewer questions, and plenty have come. The big question at the moment, Dr. Guleria, why is the COVID curve not flattening at the moment in the country? Why is it not flattening, sir?
So the COVID infection now is sort of pan-India. It has gone to smaller cities and it's also gone to some parts of rural India. And the numbers, therefore, have continued to increase. This is to some extent expected because as we move ahead from it being localized to large metro cities where the infection first came in from abroad, it has now spread to other parts of the country. And considering the population that we have, and the vast distribution of this population, the number of cases will rise to some extent before they flatten out. We will have a huge number of cases. It's only that if you were to look at the number of cases per million population, that you could say that our numbers are not that much. But in absolute numbers, we will actually have a huge number of cases.
Of course, the good news is recovery rates are also increasing at the moment, and that's the positive news that's coming in, Dr. Guleria. So at one level, of course, the COVID curve is not flattening, but if you look at the recovery numbers in this country are rising at the moment as well. So that's the good news. Just linked to that, are parts of India, Dr. Guleria, as some suggest, seeing a second wave? You know, Delhi, for example, now is seeing 2,000 cases a day. Earlier, it was really dropping. Are we seeing a second wave?
Yes, so we are seeing a resurgence of cases. We could say that we are seeing some sort of a second wave in certain parts of the country. And I think there are multiple factors for that. One factor is that, of course, our testing has gone up dramatically. We're doing more than 1 million tests per day. And in areas where we test more, we will definitely pick up more cases. But I think a more important factor is that we've, as a population, gone into what I would say is a COVID behavior fatigue. That a lot of us who were very strict or very compliant in terms of the COVID appropriate behavior when we had the initial lockdown have sort of reached a situation where we have had fatigue, where many people have just said enough is enough. And if you now go out, you will notice that even in Delhi, people are not wearing masks, people are still crowding together. They're still there. We are back to the traffic jams that we were seeing in the pre-COVID era. And all of this is promoting increased resurgence of infection, because remember, the sero-surveillance did show that almost 70% of our population is still susceptible. So this will actually drive the number of cases.
Interesting, COVID behavior fatigue, and I'll come back to that in a moment. But the other question that comes from that is, will the pandemic therefore continue into 2021? Is it now certain that this is not going to end only this year, sir?
Yes, I don't think that we could say that the pandemic will finish this year. What we could say is that we will be able to keep the curve on a flatter side rather than rising very steeply by our interventions, so that we don't have an overwhelming of our healthcare facilities, or we don't start running out of beds. But the number of cases will continue like this, or for some more time. We may see a gradual drip, but that will take a few months before we can say that we're really past the pandemic. So early next year is something that we are looking at.
At the earliest, you're saying next year, early next year. How soon is a vaccine expected is our next question, Dr. Guleria. Today, the Lancet has revealed that Russia has been rather successful with their Sputnik vaccine in terms of ensuring that antibodies are developed in the human trials. They seem to be ahead of the race. The US president says before November 3rd, the US presidential elections, we could have a vaccine. How is the vaccine in India doing? How soon do you expect actually a vaccine anywhere in the world? Because World Health Organization says not before mid-2021.
So when we're looking at the vaccine race, it's a large number of companies, including 3 from India, are actually in quite an advanced stage. But having said that, I think the most important issue for any vaccine is that it has to be safe. And even if you look at the paper which is published in Lancet today, the sample size is small. They've done it in a small number of volunteers and shown that it does is safe in them. There were some minor side effects like a local reaction, some febrile reaction, and there was good immunogenic response. But this is a very small number. You need to do a trial in a larger number, which is the phase 3 trial, before you can really say that now we have a vaccine which is safe. It will be a huge disadvantage to the program if you start a vaccine early and then you land up later on with significant side effects.
Right.
So I do agree that it's going to take a few months, but there is a huge effort to sort of compress everything in term and also the manufacturing part. So hopefully, if everything goes all right by the end of the year, but trials do have ups and downs. So we'll have to see how things evolve as far as the vaccine is concerned.
You know, linked to that, you're saying at the very earliest end of the year, that of course depends on everything going right. The next question is linked to that. How long will it take for universal vaccine coverage? To that extent, do you believe that we are still in for a long grind before, the vaccine is available universally? Should we now be sort of prepared for a pretty extended period for it to be available universally?
That is going to take some time. So to have a universal vaccine will take some time because the number of doses required is going to be huge in billions. And that is going to take some time for it to be manufactured. So when the vaccine first comes out, it will be in terms of prioritizing who are the people who get it first, and also to make sure that there's equity. There's no vaccine nationalism that is only for one country, but it's for the globe. And those who really need it the most in terms of the risk or in terms of higher mortality are the ones who are prioritized and get it first.
Let's turn to the questions that are concerning a lot of people coming in from a number of citizens. Number 2, metro services opening from Monday. How safe is it going to be to travel in a metro? Do you believe it is a safe mode of transport in COVID times?
So if you are careful, and this is like we had this whole debate when the airlines opened up.
Yes.
If you are careful in terms of physical distancing, in terms of wearing a mask properly, and in terms of sanitizing your hands, especially when you touch surfaces or touch the metro bar, then you should be all right. But if we start having a situation where the metro is jam-packed, no one is wearing a mask, and there is really no hand sanitization, we are then going to have problems. So the metro is all right, but it's our behavior which has to be proper.
Let me turn from there to a question I want to ask about the mask. Should mask violators be fined heavily? I believe you believe that those who don't wear masks in public places, whether it's metro or whether it's in any public place, whether it's a bar, restaurant, they should be fined.
So I think we need to develop mechanisms so that we make people wear masks properly. Whatever be the mechanism, that is something that has to be decided by the relevant authorities. But there has to be some sort of a deterrent so that people wear their masks and don't take things lightly. Because remember, if you are infectious and you don't wear your mask, the chance of you spreading the infection to others goes up significantly.
But would you support fining? Would you support a fine, sir? Would you support the idea of a fine as a deterrent?
So some sort of a deterrent is needed. That is something that we need to look at. And therefore, this is something which has to be decided. We have to have some strict policy in place so that we are able to make sure that people wear their mask and wear it properly. Currently, if you go out, you will see that a lot of people have stopped wearing masks or the mask is actually hanging below their chin, which is not safe, not only for them, but for the other people whom they're coming in contact with.
You know, I must make a confession that I at times also have been guilty, so I also need to sort of get my act together on that. Next question, Doctor, are gloves and shoe gloves needed for outdoor activity, or is a mask enough? Should those who are traveling by metro, for example, be wearing gloves, or is a mask enough?
So if you are able to sanitize your hands properly, then you don't need to wear a glove. You should just have your hand sanitizer and properly using the proper method sanitize your hands, and that should be all right. Sometimes people get a false sense of security by wearing the glove, and then with that glove on, they don't really sanitize the glove. And if there is infection on the glove and then you touch your face with that glove, you will again spread the infection to yourself. So wearing a glove is all right, but then the glove, you don't have to touch your nose and your face.
Right.
So I think glove is not that important if you are able to sanitize your hands regularly. And that is a habit that we all have to get into now.
So what you're saying, gloves not necessary, masks definitely necessary, and wear them well. Next question, Doctor. how risky is the opening of bars and pubs? Remember in Delhi from the 9th of September, bars and pubs are opening. Other cities are also keen on doing so. Is it risky? Should I take certain precautions before I enter a restaurant or enter a pub?
So again, you have to be very careful. Pubs and bars or restaurants have to have proper physical distancing in place and proper precautions so that both the individual sitting in the restaurant and the persons who are serving are properly take proper protective measures so that there is no spread of infection. So here again, the bottom line is that you have to be careful in terms of what we call COVID appropriate behavior, because if you don't do that, no matter where you go, you are very prone to getting an infection.
You know, what is the safest way to have dinner or drinks with friends, doctor? Many people want to go and have dinner with friends. Do you believe it's a safe way, it's safe in COVID times to be having these small social gatherings?
Honestly, I think it's still a little bit dangerous because of the fact that we know that COVID, you can have a number of people who are asymptomatic and still be infectious. And when you're having a social gathering and you're having a drink or eating, you will put your mask down and you will be talking, and sometimes your physical distance is not maintained. So therefore it's a little risky. And there have been people who've had small parties and that has led to an outbreak of COVID infection in the whole group. So I think one needs to be careful.
Would you say don't? Would you say avoid? Are you saying avoid it as far as possible even now?
I would say that currently with the increasing number of cases and where we are as far as the pandemic is concerned currently, we should try and avoid it.
Okay, next question. Are primary schools safe to open? There's been pressure to somehow or the other start opening up schools. Do you believe we are in any position to open up schools, doctor, in the next month?
I don't think so, unless we're able to see a decline in the number of cases in a particular region. That region should not open schools. This is an experience that has also been seen in various parts of the world where they started opening schools and then had an outbreak and had to close down the schools. So I think because you can't expect children to have physical distancing, wear their masks while they're in school, and they can then get infected and carry the infection to their own houses and then infect the elderly in the house. So it would be something that we'll have to delay for some more time.
Let's turn to the other questions. These are more the medical questions now that are coming in, doctor. Can asymptomatic patients suffer lung damage? We are seeing, and we've had cases where someone turns out to be asymptomatic, but a week later develops serious lung damage. Couple of cases coming. No one knows that better than you. Is that a real concern, the lung damage that asymptomatic patients are also suffering from?
So this is something which has now emerged, and this was based on some studies also. People who did CT scans of asymptomatic people showed that in about 20 to 30% of them, they found areas of patches in the lung while they were asymptomatic. In most of them, these patches disappeared spontaneously without leaving any residual damage. But in some, they did cause some degree of fibrosis or scarring in the lung. And that can be a problem at times, even in people who have no fever or otherwise asymptomatic. And that's why I keep saying that you have to be overcautious in terms of getting the infection. Some people feel that they are young and they may get a mild or infection or be asymptomatic and they will have no problem. But in a small percentage, even asymptomatic people can have some degree of permanent damage as far as the lung is concerned.
Very, very interesting. Next question. What explains the many sudden deaths that are being reported? You just said there are people even in younger age groups now who suddenly, seem to unfortunately, tragically expire. What explains that? Is there something in the virus that we didn't know of earlier that we are now coming to know about?
So this has been seen for now quite some time. We've had, even in our hospital, in our COVID hospital, some individuals who were all right recovering. And one individual I remember who just came out from the toilet and collapsed and just died there only. He was all right. He was going to the toilet on his own. And we then put someone right next to the toilet to monitor and see that people coming out don't have any problem. But we're learning that this virus causes a lot of systemic effects. And one systemic effect that it causes is clotting of the blood. And sometimes you may have a clot which may travel from various parts of the body into the lung and cause what we call pulmonary embolism, which can lead to a sudden decrease in the oxygenation in the body. And that clotting or in the lungs can lead to a sudden death. There can also be cardiac arrhythmias because the virus also causes what we call myocarditis and affects the heart. So it is now well recognized that in a small percentage of cases, there can be what is known as a sudden collapse and death.
The next question is interesting because Dr. Kiran Majumdar-Shaw was on my program. She had mild coronavirus and has recovered, and she seemed to suggest that she chose home isolation based on CT value. Do you also believe home isolation should be based on CT value? That if you're, if that cycle theory, if I'm right, if your value is low, then you should go to hospital. If it's higher, then your immunity is higher and you can do home isolation.
So a lot of people have looked at the CT threshold or to see whether this may be a good marker for two things. One is severity of disease and the other is how infectious you are. But the data is not very strong because sometimes your CT value would depend on how good the sample is, how well the sample has been taken, and at which time of the disease progression has the sample been taken. For example, if you are still having the early stage of the disease, your viral load is still increasing, and you take a sample, you may have a higher CT value because your viral load is less. But that may go up over the next few days, leading to a higher viral load, which makes you more infectious. So you can't really say that a CT value at a given point in time can predict how the infection will behave because the virus changes, the viral load changes from day to day, and it depends on which day the test has been done. Has it been done on the day when your virus was at its peak, or was it done a day before or a day later on? Second issue is that there is a lot of data which now suggests that the CT value does not correlate with severity of disease. And we have seen patients who had CT values which is high, close to 30, which suggests that the viral load is less. And then on the 7th or 8th day, they have developed a cytokine storm and had a very severe disease. So I think we have to be very careful if we start looking at CT value because of these factors. And we have to look at the patient as a whole and an individual as a complete, his age, his comorbidities and other factors before deciding on home isolation versus hospital stay.
But should the CT value be mandatory in test results? When I go and do a COVID test, should I be shown the CT value as well? Because apparently some tests do not provide CT value. Must it be mandatory?
No, I don't think so, because you must also remember that we have now different kits which look at the virus as far as India is concerned, depending on different companies, and they have different CT values. So you may have a CT value which may be, say, 18 or 19 for a given kit, and in another kit for the same CT value, it may be something like 22 or 23. So I think we should not get into the CT value because for a layperson that will create more confusion. It should be just whether you're positive or negative, and that's about it.
Okay, that's interesting that you're putting it and setting that controversy to rest. The next question, recovery rates, as I said, Doctor, are rising. Does the low fatality rate in our country, about 1.7%, mean that the virus is losing potency? In Gujarat, it was about 6-7%, for example, a few months ago. It's now coming down to below 2%. Does that mean the virus is losing potency in some form?
So the low case fatality rate has been linked to many factors. And I think there are multiple factors. A lot of data has not been able to conclusively show that the virus has mutated and become less infectious or less serious in terms of mortality. But there has been one theory which suggests that, because it suggests that if you have a virus which is causing very high mortality, then most of the individuals who got that infection would be in the ICU and then would die, and therefore the virus would not be able to propagate itself. Therefore, as a sort of means of survival and spreading from one person to the other, it suits the virus to be less fatal and more infectious. But having said that, I think what is really making a difference is that there is some host factors that gives us some immunity, because if you look at the case fatality rate in Southeast Asia, even in our neighboring countries, it's much lower than what is reported in the West. It could be related to our age. We are a younger age, and therefore in the younger age group, the mortality is less. Some people link it to BCG vaccination, and there are multiple other factors. But the good part is that in India itself, the case fatality rate is much lower than what is being reported in the West.
Just as a corollary to that, Doctor, the fact is Pakistan is actually seeing some kind of a flattening of the curve compared to us. Is that because they're just not reporting enough, not testing enough?
So that's what I think is the reason for that. If you don't test and you don't pick up cases, your curve will flatten. If we did no test, we would say we had no cases,
right, and
therefore our curve has flattened. The fact that we are doing more testing, and with that we are doing a lot of tracing, we are doing contact tracing, we are again testing them, is leading to more cases. But by doing that, we are able to actually try and get a hold of the disease and not have a resurge of cases so that our hospitals get overwhelmed.
Let's turn to the next question. And this is a real concern, Doctor. Is COVID reinfection threat serious? We've had a few cases in Telangana already, for example, of alleged COVID reinfection. Is that now a serious threat?
So there have been few case reports, one from Hong Kong and others from the West, of reinfection, which has been documented. The Hong Kong case has been well documented because it's shown that the virus was slightly, in terms of its genetic code, was slightly different from the first and the second infection.
Yes.
I think at this point in time, reinfection is not a major issue. We still have data which suggests that there's good amount of immunity that individuals have and are unlikely to get reinfection at least for quite some time. However, what happens 6 to 9 months down the line in terms of how long our immunity lasts and how long are we protected from reinfection is something that we will need, time will only tell. But as of now, this is not a major cause of concern.
Let's turn, we have a couple of minutes, we'll turn to a quick lot of questions. How long does immunity of survivors last? Someone is asking me, antibodies, how long, do they remain within the system?
So this is a question that time will tell, because this is what, it's related to the previous question also.
Yes.
Currently suggests that it will last for at least 3 to 6 months, but we need to follow people up for a longer period of time. The pandemic is not that old for us to be able to answer this question to say whether it lasts for more than a year. But there is a good amount of antibody response. And this is very important because this has a bearing on the vaccine also. Because if we are not having an antibody response which lasts for a very long time, then we will have to keep vaccinating repeatedly, which I hope is not the case.
How can we avoid post-COVID problems? What would you tell someone who has recovered from COVID to ensure that he feels completely fit and fine? What is the best way to do that, Doctor?
So this is another issue that we're now addressing, which is sort of a post-COVID sequelae. That number of people have various problems after they recover from COVID. Some people have body aches, myalgias, not able to concentrate. Some have a persisting dry cough which lasts for weeks. And like we mentioned, some have lung damage which causes breathlessness. And I think the most important things is basically, one is regular exercise, yoga, or do some regular walking and breathing exercise. Have a good nutritious diet with fresh fruits, green leafy vegetables, and a positive frame of mind. That is very important for early recovery, because the COVID itself leads to a lot of mental strain and mental stress also.
Right.
So all of this needs to be addressed. There has to be a mind-body healing that has to be done.
We've been talking over the last few months, Doctor, with you about treatment. Now, someone has just said that he got treated in Uttar Pradesh and he says doxycycline and ivermectin was used. Is that the best way for mild, moderate patients? Is there now a typical formula being used, Doctor?
So there are 2 or 3 regimens which are being used. One is the one that is used in certain places, that is a regimen of hydroxychloroquine and azithromycin. The other is what you mentioned, which is ivermectin along with doxycycline. So hydroxychloroquine and azithromycin is one, ivermectin and doxycycline is the other. And these regimens are based on evidence which is not that strong, but in mild cases it seems to work, and that's why these have become popular. Some people tend to feel that the ivermectin doxycycline combination is easier to give, and therefore that is becoming popular in certain states.
This is a question that I want to ask. Are people like me with high cholesterol more at risk? Is high cholesterol turning out to be a risk factor?
So another risk factor which is coming out is obesity. So people who are overweight and obese have to be a little careful. high cholesterol per se is not a risk factor on its own, but high cholesterol is one of the features which hints at what we call metabolic syndrome, which can have fatty liver, obesity, some degree of tendency towards diabetes, and therefore that subset of people who have metabolic syndrome have a little higher risk of more severe COVID infection.
Do sero surveys indicate herd immunity is setting in? Is there a sense that herd immunity could be setting in? You mentioned this a little earlier, the fact that sero surveys show 50 to 60% are already having antibodies. Is herd immunity slowly setting in?
So that is something that we need to wait and see. If you look at certain pockets where we had a large number of cases in the early part when the pandemic started, sero surveillance does suggest that more than 50% of individuals there got infected and have recovered. So in those pockets, we could argue that there is some degree of herd immunity. But if you look at the country as a whole, I don't think we could say that we have reached that stage, and it's going to take many months before we reach that stage. If you're looking at the entire country having some degree of herd immunity.
Doctor, is it advisable to go to the gym? Gyms are have opened in some parts. Bengaluru already has opened gyms for a while. Are gyms generally safe? Is social distancing or physical distancing the key, whether you go to a gym or whether you go to a restaurant?
So when you go to a gym, physical distancing and making sure that the instruments or the devices that you use there, whether it's weightlifting or it's using the treadmill, is properly sanitized, and you wash your hands properly. Those are the two key things as far as the gym is concerned. Physical distancing and making sure that surfaces are properly cleaned and sanitized so that you don't carry the infection to your hand.
Is daily consumption of vitamin C and zinc a good idea?
I think so. These are good supplements which can be taken. There is some data that says it boosts your immunity and may help. How helpful it is not clear, but routinely people do take vitamin C and zinc tablets, and it seems it probably does no harm, but may have some benefit.
Final question, Dr. K. Are we saying that till the vaccine comes, be cautious, be safe? Whether there's talk of opening up trains in Mumbai also now. Are we saying that until the vaccine comes, you will not have 100% protection?
So that's true. I think what we have to accept is that as we start opening up, and that is very important from the economy point of view, we will have to learn to live with COVID-19. And when we say live with COVID-19, it means that all the precautions that we need to take in terms of physical distancing, hand washing, wearing a mask, have to be very aggressively followed, because only by that means will we be able to have our life back on track and not have an increased number of cases.
Okay. Dr. Guleria, you've given us, as always, a sense of all that is important at the moment. Just to once again ask you, we are heading into a festive season, Durga Puja, Dashera, when we next meet early October. Again, be cautious is your advice, right?
Yes, I think it's more important now as we enter into the festive season, because when we go into the festive season, there is a very high chance of people crowding, shopping, buying new clothes, and at the same time having a lot of functions. And this is what will actually lead to increasing number of cases.
And as you said,
for this year, I would say the festive season has to be a little subdued. We have to be very careful, because otherwise we will have a huge increase in number of cases.
And as you said, please wear a mask and wear it properly. Otherwise, be prepared to be fined. Maybe that's the only way we will learn to wear the mask. Dr. Guleria, as always, a pleasure. Thank you very much for joining me and giving us answers to all our viewer questions on the news today. Let's take a break. When we return, this is a story you've got to see. Welcome back. Let's turn to the other big story, our Get Real India story. The former Punjab DGP, Sushant Singh Rajput, is on the run after a court denied him anticipatory bail he had sought in a case of abduction, custodial torture and murder. This report by Manjeet Sehgal is our Get Real India story.
As a police officer, he once chased Khalistani terrorists and criminals. But the tables have now turned. Sushant Singh Rajput, the former Punjab police chief, is now on the run. He is wanted in a 29-year-old case of abduction, custodial torture and murder. After Mohali court rejected his anticipatory bail plea on September 2nd, he has gone into hiding. The Punjab police have launched a massive manhunt for their former boss.
This is the scene outside his home. There are jammers, there are some police officials who are still on their duty, but there are no whereabouts of Sushant Singh Saini, who has gone into hiding ever since the lower court cancelled his anticipatory bail.
The case dates back to 1991, when Chandigarh police picked one Balwant Singh Multani from his Mohali home over alleged possession of illegal arms and involvement in terror activities. Multani was son of a former IAS officer and was working as a junior engineer with the Chandigarh administration. Saini is accused of falsely implicating Multani on the basis of forged documents. Multani's family had claimed he was tortured to death in custody at the behest of Saini, who later allegedly disposed of the body. However, the police records say Multani is absconding since 1991. Apart from the former DGP, 7 other cops have been booked in the case. 2 of the accused cops, Jagir Singh and Kuldeep Singh, have turned approvers. Saini approached the Punjab and Haryana High Court to seek relief on Friday, but Justice Suvir Sehgal refused. The case will now be heard next week.
हमने कोर्ट को ये बताया है कि सुमेध सिंह सैनी के खिलाफ अब जो गवाह आगे आ गए हैं, 2 अप्रूवर बने हैं इस केस में, वादा माफ गवाह जिसको कहते हैं, उन्होंने बयान किया है कि किस तरह सुमेध सैनी ने डायरेक्ट ऑर्डर्स इशू करके और खुद भी एक एक्टिव रोल प्ले करके मुल्तानी को टॉर्चर करा, उसको एलिमिनेट करा और उसकी बॉडी डिस्पोज ऑफ कराई। अब उसके बाद हमारा ये कहना था कि एक तो 302 धारा लगनी चाहिए जो कोर्ट के ऑर्डर्स पर ऐड हो गई। अब सुमेध सैनी पे जब से 302 धारा लगी है, उसके बाद सुमेध सिंह सैनी फरार है।
Interestingly, Saini enjoys a Z+ security cover but did not inform the police officials deployed at his residence about his movements. With Manjeet Sehgal in Chandigarh, Bureau Report, India Today.
This is a case that we will keep tracking. A Punjab DG allegedly on the run. Let's leave you with our image tonight. Days after India banned PUBG, actor Akshay Kumar has announced a made-in-India action game called 4G. Says gamers will learn about the sacrifices of our soldiers. We await to see what 4G is all about. For now, thanks for watching. Bye for now.